I presented the Part A results of the phase 2/3 RINGSIDE trial. Part A assessed 3 doses of the gamma secretase inhibitor AL102. The first dose was 1.2 milligram per day, and the second was 4 milligrams, 2 days on and 5 days off. And the third dose was 2 milligrams, 2 days on, 5 days off. The trial recruited patients with progressive desmoid tumor, either defined by radiological progression, so 10% or greater unidimensional growth on imaging within the previous 18 months, or desmoid tumor-related pain requiring non-opioid medication. Patients had to be over the age of 18 years. In terms of the safety profile of the drug AL102, it was generally well tolerated with a manageable safety profile in all dose arms. Most adverse events were grade 1 or 2. Grade 3 adverse events were uncommon, and there were no grade 4 or 5 adverse events. 4 serious adverse events in 3 patients were assessed as unrelated to AL102 by the investigator. And adverse events causing discontinuation included diarrhea, stomatitis, ALT elevation, and rash. And the adverse events were consistent with the mechanism of action of gamma secretase inhibitors. In terms of the efficacy results, early volume and RECIST response at week 16 was observed in all dose arms. There was a partial response observed at 16 weeks, which was confirmed at 28 weeks. In addition, for desmoid tumors, T2 changes reflect decreases in tumor cellularity, and there was a reduction in T2 intensity in 19 out of 21 subjects at week 16, which is obviously a very, very good finding. And in terms of MR results beyond 16 weeks, there was a consistent response across study arms and measures of deepening response over time. At the time of data cut, 12 subjects had results for 2 or more MRI scans, and there were 4 central partial responses, 1 at week 16, confirmed at week 28, and 2 at week 28 and 1 at week 40. So the conclusions from the Part A of the RINGSIDE trial were that AL102 was generally well tolerated with a manageable safety profile in all dose arms. The safety was consistent with the mode of action of a gamma secretase inhibitor. There were no grade 4 or 5 adverse events, and grade 3 adverse events were uncommon and similar across all dose arms. Efficacy was also demonstrated across all arms, and this was consistent across all efficacy measures, including RECIST response, as well as T2 and volume changes on MRI. The responses seen within 16 weeks were actually maintained and deepened over time. And the first partial response was at 16 weeks, and 3 additional partial responses have been observed on follow-up. So this result supports the initiation of Part B of the trial, which will be a randomized trial allocating patients to the drug or placebo.